Hello, my name is Azira Salihovic, and today in my informative speech, I will be talking about low life expectancy in the United States comparing to other countries such as Japan and other wealthy countries around the world. The United States currently ranks 50th for both female and male in life expectancy, continuing to fall short compared to other developed countries such as Japan. There are three main reasons for this: bad healthcare system, unhealthy lifestyle, and violence in the United States. First of all, we spend more on healthcare per person than any nation in the world by far. And yet, the United States still has a life expectancy significantly lower than any other industrialized countries. Why? So, healthcare spending per person is highest in the United States, not because Americans go to doctors and visit hospitals more often, but because of greater use of medical technology and healthcare prices that are higher than in other nations. Also, United States lacks universal health coverage compared to Japan and other developed countries and has the largest share of unmet healthcare needs due to financial costs, which directly impacts life expectancy of the American people. In this in this OECD chart, I'm gonna show you the life expectancy versus per capita healthcare spending. One nation is clearly different than all the rest, which is United States right here on the bottom. The United States has by far the highest per capita healthcare spending and on the lowest life expectancies of any of the world's richest countries. So, as we can see from the picture from this table, so we are stuck with a system in which millions of Americans have zero access to healthcare. Millions more are underinsured or have patchy coverage depending on unemployment, resulting in inconsistent care. And millions more fully insured would rather not deal with frequently changing employer-based healthcare plans or waste the time in doctors' offices despite appointments. On the other hand, Japan, for instance, has the longest healthy life expectancy on Earth and spend half as much on healthcare as the United States. That long life expectancy is partly due to diet and lifestyle, but the country's universal healthcare system plays a key role too. So everyone in Japan is required to get healthcare insurance policy either at work or through a company-based insurer. The government, however, picks up the tab for those who are poor and who cannot pay for their healthcare coverage. Another thing is that because of unhealthy lifestyle, Americans have higher incidence of obesity, cancer, kidney disease, heart disease, stroke, type 2 diabetes, gastrointestinal disorders, and high cholesterol and blood pressure. Conversely, populations like Japanese that practice healthy lifestyle and consume plant-based diets that emphasize fish and keep dairy and meat consumptions to a minimum experience a significantly lower incidence of these chronic diseases and conditions. The traditional Japanese diet couldn't be more dissimilar from the standard American diets, as we can see on this picture right here that I prepared for you. American diets relies on heavily on red meat, poultry, and processed food high in salt or added sugars, comparing to a Japanese diet includes fresh fish, rice, soy, vegetables, fruits, and green tea. So according to the research, the United States is the second fattest nation in the world, second only to Mexico, with 28% of the United States population is considered obese. Japan, on the other hand, has one of the lowest obesity rates among lead economies, coming in at 3%. In Japanese diets, portions also tend to be very small, and many Japanese they stop eating even before they feel full. While on the other hand, American diet is largely based on animal products and processed food. The diet is high in calories and saturated fat, and it's also served in oversized portions. Finally, not only do Americans live shorter lives, than people in other wealthy nations, but they suffer more violent deaths compared to their peer countries, according to report. Researchers said that violence is due in part to the widespread possession of firearms and the practice of storing them at home in unlocked places. Gun violence is just one of the many factors contributing to lower US life expectancy, but the finding took an urgency because the report came less than a month after the shooting deaths of 26 people at elementary school in Newtown here in Connecticut. The United States has about 6 violent deaths per 100,000 residents, which is way too high comparing to other wealthy countries around the world. For many years, Americans have been dying at younger ages that people in almost all other wealthy countries. In addition to impact of gun violence, Americans consume the most calories among peer countries and get involved in more accidents that involve alcohol. People living in the United States lose more years of their life before they reach 50 due to alcohol and drug consumptions compared to all other nations in the study. So, to conclude my speech, I would like to say that to improve our life expectancy, we have to focus on developing better. We have to focus on developing better healthcare system, which is going to be much cheaper, and also we have to focus on developing and trying to improve our lifestyle and also decrease violence in our beautiful country, which is United States of America. So thank you for listening to my speech.